Hello everyone. In today's class we will learn about cell injury and cellular adaptations. Whenever the normal environment of a cell is made abnormal, that means there is some factor which is affecting, which is inhibiting or which is hindering the cell from doing its normal function, then the cell has to choose whether it needs to adapt to the situation or succumb to the situation, that means to get injured and die. What could be that factor? What is the cause for the cellular adaptations or cellular injury or cellular death? Or in a way, what are the various disease processes which can occur, the causes for the disease which can occur, which are affecting the normal cellular functioning? Let us try to observe them. The first and foremost, a very important factor or cause for disease to a cell is ischemia. Ischemia means reduced blood supply to a particular cell or a tissue. Number 2 is hypoxia. Hypoxia, I am sure you know very well, it is reduced oxygen availability to a particular cell. Number 3, there are certain physical factors which can affect the normal functioning of a cell. Like for example, extremes of temperature. There is a frost bite in extreme cold, or there is a sunstroke in the extreme heat environment. The other physical factors can be pressure or mechanical forces, or sometimes there can be physiologically increased demand what is kept on a cell. For example, you go to gym and then try to work out, and there is a physical pressure which is kept, there is a demand which is kept on the cells to change their normal functioning. And then comes the chemical factors. Of course, the list is endless. Chemical factors like toxins which are mixed in the food, like heavy metals, mercury, lead, tin, etc. Or there can be pesticides, insecticides in the foods what we eat. Or even very interestingly, glucose or oxygen, which are essential nutrients for us, when they are in excess they can turn out to be toxins. That is why oxygen therapy also can prove to be devastating sometimes. So after learning about these factors which can try to produce certain imbalance or try to come in the way of a cell's functioning, what the cell should do? The cell should wisely choose between two options. Number 1, either to get adapted to the situation so that once the good times come, again the cell will resume back to its original functioning. Or if the insult or if the conditions are getting worse and worse, and then the cell will land up into cell injury. Let us first observe what are the various adaptations a particular cell can take. There are 4 major adaptations a cell can take. Number 1, hyperplasia. Hyperplasia means increase in the number of cells. The best example I can give you is the breast tissue. So as the girl is increasing in her, growing in her age, under the effect of the hormone was not once present. So increased hormone is an increased demand again. So to that, how is the tissue getting adapted? By showing hyperplasia. That means by increasing in the number of the cells. The hyperplasia what we have seen in this example is physiological. But now there is also a pathological hyperplasia. Like in men who are turning around 45-50 years or even above 50 also, they will have a condition called benign prostatic hyperplasia, where the cells in the prostate gland, they start increasing in the number. Number 2 is hypertrophy. Hypertrophy means it is not the increase in the number of the cell, but it is the size of the cell which is increasing. Like an example which I told you in the beginning, a person going to gym will see that the muscle is growing in size. The increase in the size is basically because of increase in the size of the muscle fibers. This is the example for hypertrophy. So what is the demand here? It is the pressure, what is being applied, the mechanical force, a physical factor which is important here. But when you look at the same hypertrophy in a disease process, the best example we can think of is cardiac hypertrophy, because after a prolonged increase in the afterload onto the heart, like how it happens in people with hypertension, so the ventricular muscle will undergo hypertrophy, and eventually the hypertrophied heart will land up into heart failure. The third important adaptation what a cell can do is atrophy. Atrophy means simply the decreasing in its size and its functioning. The best example physiologically I can give is involution of the uterus. During the pregnancy, the uterus of a mother which is very small will grow enormously to lodge the fetus. But soon after the delivery, the uterus should come back to its original size. So how is it able to do so? By means of atrophy. But the same atrophy can happen in a disease process. The best example being cerebral atrophy. If you have seen a CT scan or MRI of older people in your house, then definitely the impression will be like cerebral atrophy, where the size of the brain cells is coming down. Or there can be disuse atrophy. If the person or a patient is bedridden for a long time, for months together, the muscles are not being used, the bones are not being used, so that leads to atrophy of them. This is called disuse atrophy. Mostly you will see in paralysis patients. Then coming to the fourth important adaptation what a cell takes is called metaplasia. This is quite interesting. Metaplasia means a cell belonging to one type is replaced with another type. Example I can give you. Say a person is a chronic smoker. So the smoke is continuously going in his breath, and the respiratory epithelium is exposed to that. So now what is the factor here? A chemical factor, a toxin. So with that what happens? Normally the epithelium of the trachea, that is the respiratory tract, is ciliated columnar epithelium. That will turn into a squamous epithelium, because squamous epithelium or a stratified squamous epithelium which you see in the mucosa is relatively resistant to that effects of the smoke. The same can happen in a patient with reflux esophagitis. When the gastric acid is coming out into the esophagus continuously, so the acid in the esophagus will try to, that is a continuous triggering a chemical stimulus now. So esophagus, which is a squamous epithelium, will now turn into a columnar epithelium. This is called metaplasia. And now students, we should question, how far is the metaplasia beneficial? It is actually not. Why? Number one, because the cells have changed their architecture, they have converted from one form to the other, the normal functioning will be lost. Am I right? Like for example, in a person who is smoking, there is no mucus being produced. There is no escalatory cilia mechanism, which is innate immune mechanism in the body, that is missing out. Similarly, in the esophagus, which is supposed to be a squamous epithelium, is now getting converted into a glandular type or a columnar type, where it can be at any time convert into a cancerous condition. Okay. So these are the four major adaptations what a cell can take when a particular insult is being presented to the cell. If these adaptations are for continuing for a longer time, particularly metaplasia, or if the cell is not able to come back from these adaptations, then what will happen? The cell will eventually lead into injury. The injury which can happen to a cell is basically again two types: a reversible injury and an irreversible injury. In the initial stages, that is in the reversible injury, there will be three changes which are happening. The oxygen will be deficient or deprived, and because of that the oxidative phosphorylation will not occur and all the chemical reactions will come to a halt, and more so the cell starts swelling and starts showing blebs in the cytoplasmic membrane. So that is a reversible injury. If we are able to correct the cause which is causing an injury to the cell, it might come back to a original form. But when it is not being checked, and the cell will eventually lead to a point of no return. This is called irreversible injury. Once the cell or a tissue lands up into an irreversible injury, it will eventually lead to the cell death. In the irreversible injury, what is most important is the mitochondrial damage which is happening. This is more important, and the cell will be flooded or loaded with all calcium deposits. This is what happens in a person, in a patient who has, like for example, myocardial ischemia, what do we call as heart attack. So in the first stages there is ischemia. So there is reduced blood flow to that particular tissue, so that heart cell will start showing certain changes in its function. That is a reversible injury. In the reversible injury state, if you are able to intervene and then try to correct it, it will come back to the original form. But if it is not corrected, that cell will die, and the died cell will be replaced with a calcium and a fibrous material, what do we call as infarction. Okay, fine. So now consider the cell has landed up in an irreversible injury and the cell is destined to die. What are the two mechanisms a cell can die? There are two mechanisms called a necrosis or an apoptosis. Necrosis means it's always a pathological way. That means there is certain infection, there is certain bacteria or virus or immune reactions or maybe some genetic problems which have ultimately led into a disease process, okay, and the cell is undergoing necrosis. So in a cell which is undergoing necrosis, what happens is that the plasma membrane disintegrates, the lysosomes get activated, all the cell organelles are lysed, and the entire area where the cell is there, that is the tissue, is all messed up with the inflammation and the bacteria. But whereas it comes to another form of cell death called apoptosis, this is quite interesting. This, I should say, the sacrifice by a cell. If the cell thinks that it is not able to withstand the pressures, okay, it can be any of the conditions what we have seen, the cell operates a suicide program. This is called a programmed cell death or apoptosis, where certain chemical pathways and mechanisms are triggered inside the cell. Its cell membrane is remaining intact, but the cell will gradually shrink in size. Whereas a necrotic cell will start swelling up and then bursts out, an apoptotic cell will start shrinking with a normal intact plasma membrane. In a necrotic cell where the nucleus starts showing multiple changes like what we have seen, pycnosis, karyorrhexis and karyolysis, in the apoptosis such changes are not usually seen. And more so, students, let me tell you, apoptosis is a physiological process also, where, like for example, when you and me were the fetuses inside our mother's womb, every second some 10,000, 100,000 cells are being produced through mitosis. But from them, 50%, 60% are apoptosed and only 40% will remain. They differentiate, that means they turn into a mature form. So apoptosis is very important to maintain the cell number homeostasis. Every day the skin cells start continuously, they keep growing. If apoptosis is not occurring here, the control on the rate of the growth of a cell is not possible. So the cell death will basically occur in two forms, necrosis and apoptosis, we have seen. And necrosis is always pathological, I told you. Apoptosis is mostly physiological. That means some amount of it can be pathological. Particularly in viral infected cells. When a cell is infected with a virus, the cell thinks that, come on, I am loaded with a bad virus, then I should commit suicide and then die. So this apoptosis is happening secondary to a infection with a virus. So apoptosis is also happening in a pathological condition. And this completes our class on cellular adaptations and cellular injury.